I'm Nick Altmeyer with linkinglewiscounty.com. We're here this afternoon with Lewis County Manager Ryan P. Shea with all the questions out there about the vaccination distribution process here in Lewis County and things like that. Ryan has agreed to spend a few moments with us and answer some questions. So we appreciate your time today, Ryan. So I guess we can start out with just so people kind of have an understanding of what the process looks like and things like that. How are vaccine doses allocated to Lewis County, and who makes those determinations on how many doses we get each week?
Yeah. So first of all, Nick, thanks for having me. I know that your phones have been ringing. People have had questions. Our phones have been ringing off the hook. So we just want to take some time to hopefully clear some things up. So the first thing that people need to know is that there is more people that are eligible for vaccination across the United States than we have vaccines. So there is a huge national shortage. So that's a problem that filters all the way down to us at the local level. So what's happening is the state of New York is getting a weekly allocation of vaccines from the federal government. That allocation has been somewhere between 250,000 and 300,000 typically on an average week. The state of New York then takes their allocation and divides it up to the regions by population. The North Country region, which is 7 counties from Jefferson County all the way across the Adirondacks to Plattsburgh and Clinton County, is only 4% of the total New York State population. So we make up a lot of geographical area, but we represent a small portion of the population. So the state takes their 250,000 vaccines, divides up the percentage that goes to the North Country region, and from there they divide it to the counties based on our population. Now, Lewis County with 27,000 people is the second smallest county in the North Country region. So, our allocation has typically been about 100 vaccines per week to Lewis County Public Health, and another 100 vaccines per week have been going to Kinney Drugs. Now, we have other pharmacies that would like to get involved. Walmart, for example, the pharmacy in Harrisville, but the state has not yet begun sending them vaccines directly. So that's the process that the state takes. Each week they look at the numbers. They look at how many we have vaccinated in phase 1A, how many we vaccinated in phase 1B, and how many seniors we vaccinated. And based on those figures, they either increase our allocation, like they did last week. We got 300 vaccines last week, or they hold us steady like they did this week. We only got 100 vaccines this week. So that's what's going on behind the scenes. There's not a lot of room for decisions or input or say from individual county governments. So, we obviously would like more vaccines. We could do more if we had more vaccines, but we are kind of strapped to the state system and their decisions at this time.
Okay. So you kind of touched on it a little bit already, but what are the entities in the county right now that are receiving vaccine allocation? So you mentioned Kinney Drugs, you mentioned Public Health.
Yep.
Is the hospital still getting doses for 1A employees, or are they pretty much wrapped up?
The hospital is continuing to request vaccines for 1A. We still have a small portion of 1A left, people that would like the vaccine but haven't gotten it.
And that's people in the healthcare industry.
Yes,
are the 1A.
Yep. 1A is frontline healthcare workers. There's a small percentage of them that would like the vaccine that haven't received it. So the hospital is still applying for first doses. But what they're really doing now is focusing on those second doses, because the hospital ran many of their clinic for 1As in early January, late December. So that 4-week period is coming up where they now have to give everybody their second dose. So that's an important thing to remember with this. It's extra complicated because it's not just one appointment, one dose. It's 2 appointments, 2 doses. So, we're going to have to keep track of those clinics that we've had certain days, because we're going to have to bring everybody back a month later to do it again.
So when you're talking about your allocated doses, do the second dose just automatically come, or do you have to take those out of your 100 doses that you get every week?
No, the second doses are automatic.
Okay.
So that's not part of our order, part of something we have to worry about. The state has reassured us time and time again that the second doses will be there when we need them,
Okay.
which is good.
Okay. Did you want to talk a little bit about, I know you've put together some numbers, so like how many people have been vaccinated so far as Lewis County residents, and kind of what groups do they represent?
Yeah. So if you take everyone who's eligible right now, which includes Phase 1A, which is frontline healthcare workers, Phase 1B, which is other frontline workers, such as teachers, police officers, firefighters, EMTs, grocery store workers, and then you add senior citizens, which are people over 65. We have about 8,000 people in Lewis County who are eligible, about a third to a quarter of our total population. So far, we've given 2,835 first doses. So, if you've got 8,000 people eligible, we've given about 2,800 first doses. We've covered, we believe, about 35% of the eligible population here in Lewis County, which, we've only been at this for a little over a month now, is not bad. I think we're cruising right along. We'd obviously like to go faster, but we're limited by the supply. Second dose, we've given 891 second doses, so 11% of the eligible population have received both their first and their second dosage. So in both respects, first dose, second dose, I think we're doing as well as could be expected.
Mm-hmm. Okay. And so that kind of touches and leads into the next question was, is the county currently receiving enough vaccine to vaccinate everybody that's eligible? So obviously the demand is greater than the supply currently. So this might be a good opportunity to talk a little bit about like what's in the pipeline. So as production of the vaccines get ramped up a little bit, allocations could increase as we get later into the spring and throughout the summer. There's some newer vaccines that are headed for approval that could change things up a little bit. So for people that have been patiently waiting, do you expect, and I know you don't have a crystal ball, but I think the expectation is that doses might start to get ramped up at some point, or?
I can tell you this, Nick. Lewis County, between our public health department, our health system, and the whole county government, we are capable of doing about as many shots as the state could send us. We will move heaven and earth to get shots in arms as quickly as we get them. So, like you said, the federal government is planning on ramping up production, which means the state will get more, which means we will get more. As we get more, we'll ramp up what we're able to do. We have shown that we're very efficient, very capable. About a month ago, we got 500 doses in 1 week, and we were able to get them all into arms in 3 days in 3 different clinics across the county. My vision, and I know the legislators share this vision, and I know our public health department shares this vision. Our vision is that we come to you. We want to set up clinics in each of our communities. We want to be down in Lyons Falls, up in Harrisville, over in Copenhagen. But we can't do that when we're only getting 100 doses a week, because it doesn't make sense to move all that infrastructure just for 100 doses. So when we get into the numbers of 500 a week, 1,000 a week, 1,500 a week, then you'll really see us mobilize and get out there to the public.
Okay. And so people that are currently in the eligibility groups, what are your recommendations? Like, what are the best ways for them to try to access a vaccine at this time?
Yeah, so basically there's 3 avenues for people that are eligible. The first is you can go online to the New York State Am I Eligible tool, and that will filter you into available appointments across the region, across New York State. So it could send you up to the state site in SUNY Potsdam. It could send you down to the state site in Utica. It could send you to a local pharmacy. That's the risk that you take, but it's a great way for people to get on a waiting list. A lot of seniors, I think, would be happy to be on a waiting list at this point, or have an appointment booked out sometime in March. At least you've got a date there that you're going to get something. The second way that people can get their vaccine is through their local pharmacy. So Kinney Drugs in Lewis County is getting 100 a week, which isn't a lot. But again, that's something where you can contact them directly, and during the hours when they're making appointments, you can get on an appointment with them. The third way is through the Lewis County Public Health Department. And when we have vaccines that are eligible for the public, like we did last week, we will communicate that very clearly to the public so that they know exactly what to do. Last week, we set up appointments through a hotline. We plan to do that again. I think internet access in Lewis County is spotty at best in some places, and it's not fair to say, that everyone in Lewis County has to compete for vaccination sites online when we know not everybody has equal access to the internet. So we'll probably continue to do things over phone, but again, that will be made very clear in press releases and announcements from the county. So right now, that's the three ways. But again, remember, supply and demand. Mm-hmm. We don't have the supply to meet the demand. So we're getting as many as we can with the supply that we have.
And just to clarify for people as well, the pharmacy doses, those are only for people 65 and older?
Yes. Yep.
So if you do qualify in a different 1B group, you still can't get the appointment through the pharmacies?
If you qualify under a 1B group, you need to work with your employer. Okay. Because the county has specific vaccines for that group, okay, and we've been taking care of them. So for example, if you are an education worker, we will contact your school directly and your proportion of vaccines every week. So we're not making that a competitive process. Gotcha. It's just we're slowly working our way through the 1B category. Okay.
And you touched a little bit on the vaccine clinics that the county public health department's already been running. I just wanted to give you an opportunity if you wanted to talk a little bit about how those clinics are going, and then if you can kind of explain the process for people, so what they can expect when they show up to the vaccine site, kind of what the process is once you get there.
Yeah, I think that the public at large, once they get through our vaccine clinics, my opinion is I think they're going to be very impressed. We've got a well-oiled machine. By the way, we've trained for this. For years we've trained for it. Nick used to cover our drills when we would set up, fake vaccine distribution sites. We know what we're doing. We're going to do it efficiently. We're going to do it in a way that is in a bright, clean environment with great parking, easy access, and we'll get people in and out as quickly as possible. When you get to the vaccine site, you can expect, I'm just going to walk you through, what it would be like to get a vaccine at one of the Lewis County pods that we're going to set up. So first thing you do is you'd register, you'd get your time, show up at your time, and we're going to have a check-in table where you're going to have to get your temperature taken, and we're going to check you for any symptoms before we let you in. Obviously, we're still in the middle of a pandemic. The people at the front table are going to give you your vaccine card, which is very important. You got to keep that with you, and some paperwork to fill out. When you're done with your paperwork, we're going to move you into a room that's designed for education. We're going to talk to you about the Moderna vaccine, which is the vaccine that we've been getting in Lewis County. Make sure that everybody that receives a vaccine understands what's in the dose and what the effects are. From there, you move into the clinic area where you'll be one-on-one with a nurse or an EMT, and you'll get your dose. They typically ask you to put it in your dominant arm. They want it, you to move that around, get the vaccine moving throughout your body. Then what you'll do is we'll have you wait. So you can't just get your shot, walk out the door. We're going to have you wait 15 minutes just in case there are any reactions. We haven't had very many reactions at all. Very, very few, if any. But there is a chance some people could have an allergic reaction to the vaccine, so we make you wait just so that you don't have an incident on your car on your way home. And while you're waiting, we schedule your second appointment, and that's it. So it's a simple process filled with friendly county employees that are your friends and neighbors, and so far it's been going really, really well.
Okay. Did you have anything else that you wanted to add about that vaccine process, or what people can look forward to in the coming weeks? I know you said you'll be communicating as things open up, so.
I just wanted to share some more statistics. I think as we get more access to data from the state, the county government, we'd like to be a little more transparent with people so you can see exactly what's going on. So like we said, there's about 8,000 people that are eligible. We've gotten about 2,800 done so far. That's 35%. Seniors, this is a category that I think most people are watching carefully. In Lewis County, according to the census, there's 1,445 people over 65 living in Lewis County.
I think that's how many you vaccinated.
Oh, I'm sorry, you're right. There's 4,755 seniors living in Lewis County, people over 65. Nick's correct, 4,755. So far, we've given a first dose to 1,445. So, 30% of all people over 65 in Lewis County have received that first dose. That's a great sign that we're moving in the right direction. That's a great sign. 185 of those folks have received their second dose. So, as time goes on, we're going to get more and more. The other thing I wanted to share is, where are people going to get their vaccines?
Yeah.
It is a confusing process that the state has set up. It really is. It's a tough process to defend, where you've got hospitals, pharmacies, state sites, local governments. It's confusing. So, in Lewis County, here's where people are going to get the vaccine. 32% so far out of the 2,835 that have received a vaccine, 32% have gone right through one of our pods here in Lewis County through the Lewis County Public Health Department. So to me, that's a great sign. It shows that if the state gives us the vaccines, we can get it done. And by the way, that's what the people prefer. They want to come locally through us and get it done. Another 25% have been done by Lewis County Health System. So your government, including the health system, has done almost 60% of all vaccines in Lewis County. 20% have gone through Kinney Drugs. Carthage Area Hospital has done 5%, and then state sites such as Potsdam, Plattsburgh, Utica have done 3%. In fact, only about 79 people from Lewis County have traveled to one of the state sites. Which is all the more reason why the state needs to make sure that they're supplying us locally and not just taking care of themselves at the regional sites. So we're going to try to get this information out there more regularly out to the public, but we're working very hard, I can tell you that, and we're really looking forward to the day where we've got more vaccines and we can get everyone in the community done.
Great. Well, thanks for your time today, Ryan. We really appreciate the update on how the COVID-19 vaccine distribution process is working here in Lewis County.
Thanks, Nick. Appreciate it.